All right, we've gotten to the top of the hour. So I'm going to say welcome as people continue to join in with us. We are so grateful to have you here with us today. It's hard to believe that we've reached cafe number 4 of 6 for the future of care for children with medical complexity. Today, we're going to be talking about family-driven approach to understand family well-being and its facilitators. I got to try to say that 10 times fast. So we're very grateful to have Nikki, Katie, and Jay here with us today. And you're very welcome to check out their bios online, but we're going to spend the time getting right into it. So next slide, please. And we are so grateful for our partners in funding this series, the Lucile Packard Foundation for Children's Health, and all the work that they do every day, and the collaborative work that they do, and the connectors that they are, and uplifting and ensuring that families are at the center and children are at the center of everything we do. Next slide, please. So this series, just to remind you, we're really looking to foster interdisciplinary dialogue and looking at systems improvements for CMC. So in these sessions, we have that 20 minutes at the start and then 25 minutes to get into the breakouts, and then we share out for about 10 minutes at the end. And family partners help co-lead every session in the breakouts and as presenters. And we have all of this is analyzed so that we can provide it out and include an interdisciplinary faculty in that process. Next slide, please. So drum roll, please. One thing to say. Next slide, please. We now have from Cafe 1, when we had everybody lay out in every way possible how you thought where you saw we are now and where we need to go in systems of care to improve quality of life and well-being for families and children. We now have an infographic you see at the top there. We have our graphic drawing completed. And we have key highlights that we're going to share out. We will share that out with all of you and publicly release those so you could start using those to your benefit wherever you sit in the system. And we're very excited to have that. And it's taken a while to put together because there is so much wonderful stuff in there that we really wanted to make sure that we were representing properly for all of you. Next slide, please. You can see here we have such a wide range of people that are attending. It truly is interdisciplinary, those top and overlapping. And those top circles are kind of the more majority of attendees, populous attendees, and then the lower we are represented, so in slightly fewer numbers. Next slide, please. So please know that raising your hand, writing in the chat box are both equally valuable, and we collect everything and we're recording this. Next slide, please. And as you can see, there are the different functions you can use. If you have any questions, feel free to private message myself or Allison Bachman. Starts with a B, so you can look her up, and you're welcome to ask any of us questions. Next slide, please. So I'm going to hand it right over because I'm so excited to have Nikki, Katie, and Jay talk to us today about some fantastic work that I've been able to have the honor of being involved with. And we're excited to have them here today. So Nikki, I would love it if you wanted to take it on over. Thanks, everybody.
Okay. Thank you. So I get to start talking about family well-being. And just to give you a little background, I'm Nikki Montgomery. I work with Family Voices, but my primary experience is as the parent of a child with a rare genetic condition and complex needs. He's 13 years old as of last week and very excited about that. But a lot of this was so important to me because I've felt like on my journey as a parent, a lot of the things that really contribute to well-being in my life were not always addressed in the healthcare system. And so I was super excited to get involved in this work because I believe very firmly that you're not going to find solutions without involving the people who are experiencing the problem. And that those people actually have really practical solutions. It's usually not like, I want to change the whole system and world. It's like, there are really solid things you could do to change my life today. And so that's why I feel like this was so exciting to get involved with. And I got to help go through the data on this project and actually see the responses. And what really gave me chills along the way was that so much of it felt like my life. Like there was no piece of this that I'm like, oh, that has nothing to do with my life. Everything resonated. And it's so complex what makes a family's well-being actually happen. It's not just, can they get a doctor's appointment? Can they get home nursing? It's what's the quality of that? And how accessible is that? And so the depth of the responses we received was really outstanding and very exciting to see how much time and effort people put into completing a survey to tell us what they really needed to contribute to their well-being. I mean, most people didn't give us short answers. There were many that gave us essay answers, and we had to break those down into the pieces. But people want you to know, and they don't have an avenue to share this usually, or they don't know where to go to share this kind of information about what contributes to well-being. I think as public health and healthcare professionals, you can always kind of project what you think is going to be the solution for families, but hearing right from them is just super valuable. So that's why I think this approach was unique. I actually got to help formulate the questions and participated from beginning to end of this project and was able to lend my own experience. And we helped pull other families into this to evaluate the questions, to see if they resonated with them. So the family engagement in this process, beginning to end, was super rich, was very authentic, and there were many family voices at the table to make sure that this reflected what our experience was. We honed down to two really simple questions, but the amount of time we spent just getting down to those two questions was super. It was very involved. And even how do we ask demographic questions? Just the process being involved from beginning to end to me was very enriching. And particularly the qualitative analysis of the responses and understanding how to theme responses and all of that. I think as you're thinking about any work you're doing, families can be involved in that kind of work. And they will inform your processes in a way that enriches what you come up with. So I'm super excited to be sharing about this today and for you to kind of see what we did, because I hope it resonates with you and the populations you serve in the same way that it did for me. Um, I know that's the uniqueness of this project, but we also want to give you a chance to listen to the survey question and respond to one of them. Bethlyn, is this the best time to give them the question? Okay, so in the chat, I'd like for you to think about, in caring for a child with complex health issues, what is something the healthcare system could do to make a family's life better? And you can also come off chat and do the raise hand thing if you'd like to share out loud.
Maybe Jess, you could take us off the slide for just a moment so we can see each other while we're just kind of taking this moment. Awesome, thank you. We've got Nikki, so I don't know if you want to take a look at the chat. There's lots of respite is coming up, which we've heard about the
Thank you.
whole
Yes.
family listening,
Mm-hmm.
training around for families and navigating.
Mm-hmm. Health literacy,
Mm-hmm.
coordination of care and scheduling appointments, funds for respite, the whole family. I think you're all going to see that a lot of this resonates with what we heard and learned. Listening was a really common response we got. Listen to me. I'm living this life. Reducing prior authorizations. Oh yeah, that's a special one in my life. What one that I have as a beef is like, why do I have to tell you every year that my child has the same condition he had last year in order to qualify for everything he had last year? So let's see, flexible appointment times, virtual options, listening again, transition from pediatric to adulthood. We heard that too. Parent identified needs, asking questions beyond the diagnosis. We heard a lot of that that went not just like my child's medical care, but how do we make sure they have a good life, not just good care? And that was really important. Something that came out of the work. Proactive, we heard that too. Medical records in one place, like access to information. Believe families. Oh, that's a really good one. Referrals, whole family care, whole child. I think all of these things that you're bringing up, we saw so much of, and we saw so many different dimensions and iterations of some of these themes. Following up, things change. In between, yeah. Let's see, and seeing a child as an individual, recognizing the expertise of the family, waitlist. I mean, what you're coming up with right now are really practical things that we heard from families too. So I love that you all are thinking the same way they were, like, what's going to make my life easier? And this was such an important thing to get them to not only identify what the challenges are, but what's the solution you recommend to make it better? because again, a lot of these recommendations are not earth-shattering. They're very practical. They're things that the healthcare system could move on. And so they lead into what policy could look like and where we could push research as well to make sure that families are getting what they need. I like the outside the room too, not just in the hospital or healthcare setting, length of time, care coordination. We heard a lot of these things. And so the cool thing is we kind of ended up being able to group a lot of the family responses into specific domains. And I know, Katie, you'll probably get into that a little bit more later too. But meeting those needs is really about just that quality of life and like what's the end goal families have for themselves and work backward instead of thinking if we just solve this medical issue, it'll make everything better. What's better for that family? What's well for that family? Um, so that was really, oh, I see siblings too. That was a major theme. I like that a lot. Thank you for adding that. So one of the things that we've seen in the past is that there is bias in managing quality of life and measuring quality of life. And we've seen that in past themes. It's not just about medical. That bias and ableism can come in when you're measuring quality of life to say, if a kid can't run, does that mean he doesn't have quality of life? It doesn't, right? And so some of that ableism and bias has come into other measures. And here we're really looking at what the families believe is quality. And families did not talk about fixing their child's medical condition. We saw that nowhere. We did not. It's not about, somehow getting rid of the complexity their child has. It's about those systems that serve them, really wrapping around and doing what they're supposed to do, which I think is very important. So I loved here just the idea that new ideas can emerge from what families came up with and the wisdom of the community you're serving being where you can find some of the best solutions. So I hope that as you all learn more about this today, you can kind of bring that in as thinking about the people you're serving have their own set of wisdom and knowledge about what their experience is. And it goes beyond them sharing a story to you looking at those stories and pulling them together to create frameworks to actually improve their lives. I do often think we can be a little spectatory with family stories like, ooh, great, I heard it. But what do you do with it? And I do think this pathway offers us a lot about what to do with what we heard because we actually ask them, what should we do? So I think that's really cool. And hopefully you can integrate that into your thought processes too, of not just kind of spectating the problem and looking at it and examining it, but what are the practical solutions you come up with from that and seeking those solutions from the people experiencing the problem. All right, Bethel, I think I can pass it back to you.
I could just listen to you all day, Nikki. Okay. You make it look so easy. Thank you, everybody. These are fantastic, what everyone's been putting in the chat too. It just is very exciting to then have Katie next share with you. So Katie, I'm going to pass the torch over to you.
Hi, everyone. It's an honor to be here. I think I'm here mostly to share what I've learned as a clinician, an educator, a researcher from working with Nikki and from the rest of the team. And she's sort of kind of given you a view into the whole spectrum of the project that we've engaged in together. And I think I'm going to take a little step back and talk about what it's meant for us to have a truly family-driven approach. And I think we were asked to facilitate this as a topic of discussion for the cafe, just recognizing that family well-being is one of the most important measures of whether our systems of care are serving the needs of children with medical complexity. I think I saw someone put in the chat, caring for the child means caring for the family. And that's what we're here to talk about. Yet, as Nikki mentioned, we haven't really been able to pin down what that is. There are so many related constructs and scales that don't seem to resonate. So we really need families to tell us what matters most so we can act on it. If you go one slide back, I just wanted to give one example of how having a team with lived experience really shaped thinking about family well-being. I think our first consideration was the importance of asking the right question that will get to meaningful answers. And through extensive discussion with Nikki, with Meg, with others, we realized that trying to come up with a singular, unifying definition of what family well-being looks like that meant everything to everyone is probably not going to be the most productive exercise. What we actually care about is what gets families to a state of what family well-being, however they might choose to define it. So this was sort of our guiding compass for this project. On the next slide, I just wanted to share a few best practices that we identified for how we work together to think about family well-being. And I think, Nikki mentioned this as well. The effort was not about just seeking answers and ideas from families. It was about developing the questions with families. So having a leadership team with lived experience that guided the study aims, the methods, all the way through to the analysis of responses, fundamentally changed the directions we chose to take. And the framing of that study question was a key example. I think it also helped to build a trusting relationship with the families who generously shared ideas with us. Nikki had facilitated engagement groups with families to seek guidance on a survey tool, and they graciously shared tips for clarifying key terms, ensuring accurate translations, making sure questions were relevant. I think these are a lot of best practices for any research project, really to make sure that you're creating something that welcomes the people you want to hear from to engage in answering that question. And then finally, I wanted to share that the method that we chose to seek these answers was intended to be pragmatic and really flexible. So we engaged in this crowdsourcing method through multiple modalities that could be iterative to help us reach families through different avenues that we were realizing we weren't necessarily hearing from. And the key to the analytic side of things was that every single response or idea shared by a family would matter and would be represented in the final results. This was not a matter of identifying the most common denominator. It was really about capturing the breadth and the complexity, as Nikki said, of families' experience. Nikki, I think you had mentioned a couple of these key points. Is there anything else that you would add to this approach?
No, but I do think you mentioned briefly translation, and we learned even in this process that translating word for word was not going to work for this. And so how you translate and how families from different communities perceive a term or the way a question is framed was really important. So making that culturally responsive was something that was really positive, I think we did.
Yeah, that's a great point. Just this concept of family well-being in a way is a little bit of kind of research lingo or a construct that may have different connotations. And so trying to break it down into what does it look like when a family is doing well, and knowing that that might translate into someone's day-to-day life as probably a more appropriate way to sort of frame that type of question. On the next slide, I wanted to briefly share the different ways that we sought to connect with families with children with medical complexity. And one thing I'll point out is that through having a leadership team with lived experience, we were able to think creatively about ways to reach families who may not be as well connected to professional established organizations, who may, not typically be asked for their ideas. So for example, we reached out through a number of social media outlets that serve children with medical complexity, of which our team were authentic members. And I think that also helped us to make sure that we were reaching the people that we needed to hear from. On the next slide, I think it's also important to share the way that we talk about or present studies to families. So this is Nikki's beautiful work. Really how these studies are depicted also really matters. And having that communications expertise to welcome families to engage was extremely valuable. On the next slide, I just want to share, we heard from over 300 family caregivers representing every state about what it looks like when their family is doing well. And our goal today isn't actually to go into detail about our study findings. I think we're still having conversations about how to best respond to everything we've heard. We're really hoping to just share a fundamental message that we received from families about what facilitates family well-being. And on the next slide, you'll see we received 800 ideas. Some families shared 12 things that get them to well-being. And to give you an idea, if you just click through slowly, Jess, you'll start to see that these ideas really spanned multiple domains. A child being healthy and at home. If you keep clicking through, when someone's doing well as a caregiver, these are just the broad strokes. When siblings get what they need, when we have resources and supports, when we are included in our community, and then one last one here, when we have the support of our healthcare team. As broad domains, these may sound very familiar with what everyone was just putting in the chat. And I think, what Nikki was speaking to was really just the depth, the intensity, the range of responses that are included in each of those domains. We want to make sure that we honor that. If you click to the last slide that I have here is really just this bigger message of this cafe is that we're not just intending to ask families for their stories and ideas about what family well-being looks like for them. We need to tie it to meaningful action. So our big questions that we're hoping to wrestle with is how do you honor 800 complex, messy ideas about family well-being and the signal that that gives us as an academic community about its importance in so many areas of a family's life. So that's what we hoped to focus the conversation on today. And I'm going to hand it to Jay to help guide us through some of those questions.
Fantastic. So we've got a few breakout questions for you guys to consider. Bethlyn, do we have that on a slide, or should I just
That's on the next slide. We wanted to just pause for a moment and see if there were any questions or comments that folks had while we were in between this and our next step in the process today. If anyone did have any thoughts or questions, you're welcome to throw into the chat and or raise your hand so that you'll come to the top of the screen. So we'll be able to see you if you do that. All right, great. So if you go to the next slide, Jess, perfect. Take it away, Jay.
All right, so here are your big breakout questions. So the first is, what are meaningful ways of assessing family well-being for families with children with medical complexity? In other words, can we come up with some situations, strategies, ways on how to bake in an assessment of family well-being at any level of the system for the purpose of using it and taking action on it, as Katie and Nikki were talking about? So I'll give you an example. I don't want to coerce too much of the thinking, but like if I were to think about that question, I would think about, for example, could we charge the AAP to mandate that in every well child visit, or at least once annually, a pediatrician should ask about family well-being to a family of a child with medical complexity, and then write an action plan on how to help it. Okay, something like that. But you could think about how could it be used by a Title V program for assessing family well-being, or a Medicaid program on care coordination, or I mean, anything. Like, how could we just start to bake this into the system? Practical ways of assessing family well-being, knowing that it means different things to different families, to still put it at the forefront as one of the pinnacle outcomes that we should be moving the dial on for children and families. And then relatedly, this second question, how should we educate, build awareness of facilitators for family well-being of children with medical complexity? So for Katie and Meg and Bethlyn and Nikki and I, like traditionally in the academic setting, if we complete a project, we would historically like write up the project, publish it in a journal, a medical journal, peer-reviewed journal, and that would be like our semblance of success. Like, what, we published this, it's out there, people can read about it, we've done our job, fantastic, move on. And we just don't feel like that's enough for a project like this. Like, there needs to be more, much more than that. And so we'd like to really think about creating a multifaceted approach of getting this information out there to everyone, to every stakeholder, to really try to spark action on how to use it. So we want to think well beyond like manuscript publication for this one. And so we would love to hear ideas of anything. Like, how do we get this information out there in front of folks to use across any sector, from the families to the clinicians, the policymakers, researchers, so that they can go somewhere or multiple places and really find out what family well-being means for children with medical complexity and figure out how to use it. Piece of cake.
Everyone's got this. I know it. I believe in us. So just to help you understand, I'm not going to go into detail around this, but we are using our collective wisdom, knowing that as families of CMC told us, and the CMC coin, our whole life is a quality improvement project, and we're just going with that, the spirit of that here. So, and what this will be graphically represented after by Karina Branson. Next slide, please. And we're just going to go into breakouts now. You can finish your thought in the chat too. We're going to do right now. I'd love to offer, I'm going to just start with Rahel because I was with her in the first room. I call it a room one in my mind because I put everything together. So Rahel, could you please share? We're going to offer each family leader the opportunity that was co-facilitating to share their key takeaway out loud. And we'd love all of you to look at what you've happened today and share your key takeaway in the chat. It all gets drawn into the synthesis that we are creating for each of these. So it all contributes. So I'm going to start with Rahel.
Yeah, we had a pretty rich discussion on, how do you assess it? And we came up with different ways to phrase these questions. What is feeling hard for your family right now is one. And there were different iterations of that. And there was suggestion that this should be added to SDOH screening that is routinely done. And there was a suggestion that there should be training that everybody from the front door all the way to the medical director should be aware of this assessment of how the families are doing and look for things that are said and unsaid, things that suggest that family may not be doing well, missed appointment, repeated scheduling, asking questions about whether or not family can do the things that they need to do to take care of themselves, take a shower, get enough sleep, etc. And then on the second question, there was a lot discussed about how to do this. And especially once families share, then what do you do? There were suggestions about having a community health worker model, having webinars to clinicians, connecting closely with family navigators and social workers. There was discussion about somehow having a system that allows more time because families will unload a very painful and difficult things, and then it's 15 minutes and it would not be right to. So if there's mandating that's going to be done through AAP, there's got to be a system by which support can be provided or referral can be provided. These are the sort of things that came up in our group. I don't know, Beth, I may be missing some.
I think you did great. Thank you. I think we're also going to be able to take all what happened in the breakouts and synthesize that together. That's part of what we'll do. So we appreciate people sharing. So the next, I'm going to ask Shauna to share from her group a key takeaway. And thanks for continuing to share your key takeaways in the chat too.
Yeah, I loved our group discussions. Margaret started us out by just calling out, that children with medical complexities are already so dynamic, and that family well-being is just as equally dynamic, right? It's ever changing, and that makes it even harder. Like, what is my well-being today is not necessarily tomorrow. And the trauma of it too, of how do we reduce, or like Courtney said, how do we start healing through that trauma, connections and getting the tools and stuff like that, to really dig down into what family well-being means for all of us. And then I love that Stephen and Jay brought up kind of from a policy provider standpoint. Stephen said that he felt like from the policy piece that we actually needed to get more details going of what we identify as inadequacies in policies, because that's really the only way that we're going to make any changes. I'm sorry I didn't write down who said it. I think it was Audrey who talked about diapers, and our options are not great when it comes to deciding what diapers to use for our children. And so until we start putting that information out there and getting more specific about these inadequacies, then policy isn't going to necessarily change. And then as far as our question for how do we build awareness and educate, I love that a lot of the discussion was not just that the literature and stuff wasn't the best avenue, but how do we bring that forward to families, not just in medical journals and that type of thing, but how do we make that more accessible to more people? Carolyn had talked about, family voices and websites and that type of thing. And then also potentially even podcasts to bring the information and get it out there. Because the family organizations really have difficulties getting access to that data, which is what drives the grants and the, that type of thing for, making these changes. So please, whoever's in my group, Jay, please speak up if I missed anything really important.
We're also going to hit the talk shows. It was a great suggestion. So I just texted Oprah Winfrey, and stay tuned.
Excellent. I'll be there. So I'm going to go
Name, choose me.
to Becky, and then we'll close it out with Nikki. And I'm going to start throwing some things in the chat too, just for that instead of speaking it, because I want us to get to hear the key takeaways from you all. So I'm going to just put a few more things in closing in the chat.
Great. I tried to summarize ours so I could be quick. So before asking questions, medical professionals really need to know what's in the chart and not waste time asking questions that they could have learned ahead of time. And then they need to consider how questions are being asked of families. The questions really can't be the same for necessarily every family. And once questions are answered, professionals should confirm their understanding of what families' priorities are and not assume that they got it right from what they heard. On a side point, but really critical, is we need medical professionals who speak multiple languages, so interpreters aren't always needed. And as far as educating others and increasing awareness, we need to, the comment came through that we really need to normalize disability so that our families aren't seen as a charity case, because really what we're talking about here is a shared humanity across all people. And then, of course, reaching students during their education and learn about the needs of families and how to talk with families. I turn it over to you, Nikki.
Thanks, Becky. I know we've got limited time. So I'll start with one of the things that we came up with for the first question in assessing is seeing families outside of an urgent care situation or a hospital setting. And so that could mean family as faculty. It could mean visiting the home and having opportunities to see children when they are well and when their families are doing well. And then when we talked about ways to share information, it's really going where people are having these conversations and making a grassroots attempt to spread information. And so that can be with families who are going to share with other families, with providers or grand rounds who are going to share amongst their networks. Thank you.
Wow, that got us way quicker than I thought. You are professionals. So please continue to share any of the key takeaways in the chat that you may have. I put a link into the chat for our next cafe coming up on October 30th. You'll get to hear more from the wonderful and dynamic Nikki Montgomery, as well as Dr. Michelle White. We're very excited for that Health Equity and Anti-Ableism Through Family Partnership. That's our 5th of 6 cafes. And the last but not least, next slide. You can see our future cafes here, and you can also check out any that you've missed. They're on our page for the recordings, and as we continue to release handouts and highlights, you'll see those there as well. And we're going to immediately after this share with you Cafe 1 and the recordings in the next couple of days and follow up from this and continue to share those out with you. Next slide, please. And the evaluation really does make a difference for helping us, and it's a place to continue to share your thoughts on the questions. Next slide, please. And here are the contacts for everyone today. We're so grateful to them. Thank you, Katie, Jay, Nikki. We so appreciate everything that you've shared with us today, the work that you're doing, the space you all hold. We are so grateful because we all do this together. It's the only way we're going to get there. Only we're going to get there. So we will see you on October 30th, and please reach out anytime in the meantime. We are just delighted to be doing this with you all. Keep up the good work.